Welcome back to the Lipoedema podcast. We are your host, Shell.
And Tiana, and tonight we are joined by a very special guest, Kristin Osborn. Kristin, thank you so much for joining us tonight.
Thank you, girls. It's an absolute pleasure.
Now, you are so many things for us and for this community. Instead of going through your extensive and impressive bio, how about you tell us a little bit about yourself?
Okay, so I first learnt, I learnt when I found out through my studies. So when I was doing lymphatical studies, I found that there was a tiny little paragraph saying this thing on lipedema, and I thought, that sounds like me. That sounds like me. That sounds like my legs. That sounds like my family. So I sort of went steam training into every bit of training that I could get my hands on. From there, I figured out that, and through family photos and things like that, I found that my lipedema started around about age 9. It could have even been before that, but there's some photos that I have. So I was listening to one of the items on one of the conferences, and it said, yes, you can actually get it prepubescent. And I thought, well, yeah, I had mine. They're the photos that I can have, well, that I've actually got. But I remember even earlier than that having symptoms and so forth of lipedema. So from there, I thought, what is this thing? No one knows about this thing. I have to know about this thing. I wanted to know for myself and my own legs, but also for my patients at the time as well, because I started off as a remedial therapist. Then I became an osteopathic correctional therapist. So in there, then I started to see women coming in and they'd had lymphedema from cancers and so forth. And then I thought, right, this lipedema thing, it's like no one in Australia knows about this. So I need to know all about it. From there, I sort of got known around my area, and I was invited to the first lipedema conference in Sydney in 2014. And then people started to get to know me, and I got to know other speakers. Professor Neil Pillar was there, Dr. Mackey was there, there's a few others that were there as well. So that sort of kicked everything off for me. From there, then I started delving into best types of compression and just started to really delve into myself and notice what worked for me and my legs and my weight and so forth like that. So I found these foods that where I'd lost 35 kilos, and people were saying to me, "You've lost weight," and I was like, "Have I?" I wasn't even trying to lose weight. I had no clue. I was just starting to eat these foods, and I felt really, really good eating these foods. So then I thought, let's delve more into that. So from there, I became a nutritionist. From there, I wrote my first book. So I've written a couple of books. My husband is a cook. So we first wrote a book called The Angry Cook, and we released that. And then from there, we wrote the lymphatic friendly diet book, and it was self-published. So it only had like pictures of recipes that my husband had done, because I was in the bath one Sunday, and I came out and I said, I'm going to write a book on this. And he went, oh, okay. And I said, and you're going to write all the recipes? And he went, oh, all right. So, but that's what he does. And he's very, very talented at that. So we wrote the book, and we got that out. And then patients were saying, we want more information. The information that you teach us here in the clinic, can you put that in a book for other people? So that's when I really did the lymphatic friendly diet book, and I had it published worldwide. And it's still number one after 10 years. So it's been very, very successful. Thank you. So from there, I thought, what else can we do? And I actually teamed up with Reed Sleeve Compression back in 2009, because I'd found this garment, had it on this lady. I've got these photos on my website under Reed Sleeve, and this elderly lady walked in. She had this big leg. It was completely damaged. We put a garment on her. 2 weeks later, she walked in the clinic. She had a leg ulcer on the other side that she couldn't heal for 8 months. She walked in the clinic 2 weeks later. That leg was down, and that ulcer had healed. And I thought, this is a garment I need to be attached to. So I joined Reed Sleeve as their Australasian compression supplier. And from the Congress last year, I met a lot of surgeons, and when I was over there, I noticed that they put compression on and then they wrapped. And I said to them, is that expensive? Is that hard to do? Oh, yes. So from there, then I talked to them about the reed sleeve, and then we started to become the European supplier of reed sleeve for the surgeons over there. The surgeons here, the ones that are at the Congress, they know about reed sleeve as well. And I've just had one of my patients go through with a surgeon with having the reed sleeve on, and we've seen the difference in the legs, and I've got those photos up on my website as well. From there, then I started to sort of dabble in a lot of different products, and they'd have to work on me before I would have them in the clinic, and a lot of them went west because a lot of them are junk. But then one of my suppliers, they went broke during COVID. So I thought, okay, well, I need to do something. So I actually spent 9 months studying aromatherapy, and I put together with an industrial chemist my lotion, my new limb lotion. It's just been picked up Australia-wide by a very big online shop, and it will be at the conference. And to back that up, I've just spent 3 months making the wash to go with it. So that's coming as well. So they're those two. From there, then I had weight loss surgery patients who would come out of surgery, and they give them like a stock cube in water. And I was like, do you all get a stock cube in water post-surgery when you've just had major operation? This could be bowel cancer, could be abdominal surgeries, all sorts of stuff. And they were like, yeah. So I went into work with my husband, and we made the lymphatic-friendly soup that they could take as a cup of soup after their surgery, and it's full of nutrition. So it's very, very high in nutrition, and that puts all their salts back, and the thyroid, anti-inflammatory, autoimmune, all sorts of stuff. So we made that. Then I'm a tea drinker, so I like my tea, and I've got fatty liver disease as well as more liver disease from Epstein-Barr virus. So I made a tea that covers all of it as well. So that's the lymphatic-friendly tea that we make, and that's made in-house, both those two products. So,
Kristin, can I just stop you there?
yeah.
You are a go-getter. Oh my goodness. You are a woman after my own heart. Like,
And I got my hippy lippy lady Lipoedema awareness store.
oh my goodness.
I can tell that you and Shell are going to be best friends instantaneously.
So I see a hole, and I want to. I'm like, I can fix that. I know what I've got to do to fix it, so I'm just going to fix it. Yeah, and I've had hippy lippy lady for years and years and years, and people saw it on my site, and they're like, because I used to have a picture like hippy lippy lady, and then they said, where can we get a hold of that? So then I made this, and I've got cups and hoodies and socks and mats and God knows what. So yeah.
Awesome.
Do you know that you've just blown my mind, like in the first sort of 2 seconds of your introduction, because for some reason I knew you did all these things, but I didn't realize that you also had lipedema.
Oh,
And
yes.
so I was just,
Oh, yes.
I was
Yes,
just
yes,
like,
yes.
oh, she's one of us. And
Oh,
so
I'm one of
this
you.
all,
I get it.
yeah.
Yeah, I made a lot of this, and I studied a lot of this for myself because I saw what my grandmother went through. My grandmother went through hell. Both of them had it, so I had it on both sides. But my Dutch grandmother, horrendous, just horrific. And I thought, I don't want to be like that. What
Yeah.
can I do? And that's where my passion comes from. I'm always learning, researching, updating, practicing, doing all sorts of stuff just to have my legs stay the way they are, and that sort of thing. So yes, it's very personal for me. My brother has it.
Wow.
So don't think men can get it. Men can get it.
Yeah.
Yeah.
Yeah, a previous guest of ours also said that she had a brother, or that also had it. So yes, fascinating.
Yeah.
So you mentioned going to the very first Lipoedema conference in 2014. Can you just expand on when it was that you first learnt of Lipoedema?
Probably just trying to think back. Started the clinic back in 2005. Probably around about, I would say around about 2000, and that was then probably about 2007,
Gotcha.
2008. Yeah. So I'd already been working on patients and learning lots of study. In the beginning, I just studied everything I could put my hands on. And so I studied from around the world. I've got certifications from you name it. I've got every single certification known to man. So, and some of them came from Korea, Scotland, like you name it, everywhere. So, so that's when that sort of came on. And a patient of mine she came in with spondylolisthesis and problems in her spine. And so I used to do remedial work on her. And I happened to say to her, do you have problems with your legs? And she said, oh, not really. And I said, okay, I'll just leave it. Well, I'm not going to start anything if you're not worried about it. But then she her and her husband bought a cafe, and she was on her feet all the time. And then it exploded. It exploded to the point where she was in so much pain, she couldn't work and that sort of thing. And I helped her with that. And then from there, she got very involved with Lipoedema Australia and with, what was the main lady's name?
Jen.
No.
No.
Norma?
Yeah. And she said, I know this lady in Newcastle and blah, blah. And that's when they said, would you come down and speak? So I was basically the therapist that was teaching people what I did for my lipedema to stop pain and stuff like that. So that's
Gotcha.
yeah.
Oh, fantastic. Amazing. One of us and servicing our community.
Yeah.
Amazing. So, okay, so you've got, massage and osteopathy and nutrition. Yeah. So then when somebody comes to you with lipedema, what's your professional approach?
Okay, first thing I do is they usually contact me, or the doctors usually send through a referral. I get lots, and I'm very well known here in Newcastle with doctors and so forth, because I actually spoke up at HMRI as well, which is the John Hunter Medical Research. So they sort of got to know me on that level as well. And so I send them out a questionnaire. They have to fill it out, and then they bring it in with them. So when they bring it in with them, so I had a patient today, when they bring it in with them, I then sit down. So I go through bloods, I go through their medical history, their surgical history, and then a lot of different branch outs because I'm looking for certain stuff. That's what I'm looking for. So they fill out this 2-page questionnaire. Then from there, I go through it with them. And then I've got sheets in the clinic where then I go through therapist checking as well. So I probably go through around about 2, 3, 4, 5, about 6, 7 sheets. I do a full assessment, and then I get them on the table for a treatment. So I'm looking for things in the treatment. There's lots of things that I'm looking for that I ask questions about and that sort of thing, so I can ascertain. I do measurements and all sorts of things. And then at the end of it, then I give them their diagnostics or their assessments, which I've come up with. Then we go through how I can help with that. So it's an individual plan for them specifically, because not everyone's in the old square box. We're all completely different, I can tell you. So I work it out specifically for them. And then, so they're education classes where they'll come in, have a treatment, and I'll go through their particular type of education that's pertinent to them. And then we sort of just go from there on. So that's usually how I work that. If I can't get someone into clinic, I'll do it online.
Gotcha.
So,
that's good.
Yeah.
You've got that versatility because, of course, people with, stage 4, people with severe lipedema and they have mobility issues, they may not be able to get to a
and I don't have wheelchair or walker access here. So if I can't get to those, then I'll usually do it online, that sort of thing. So, yeah.
Nice. And I'm curious to know, what are the things that you are looking for in your assessments?
I'm looking for lots of things. So I'm looking to see if they've got compartment syndrome. I'm looking to see if they've got mast cell activation disease. I'm looking to see if they've got Ehlers-Danlos syndrome. I'm looking to see if they've got any any of the sort of chronic diseases, obesity disease, stuff like that, because they are 2 separate diseases. I'm looking for blood clotting diseases, Cushing's disease. Crohn's. My brother has Crohn's. So I'm very aware of Crohn's. If they've got psoriasis, if they've got plantar fasciitis, or just all sorts of different things that I can say, okay, I can help with that. That's very lipidemic. I can help with that, help with that, help with that, help with that. I'm going to refer you on to that. So there are times when I will pick up psychological issues, body dysmorphia issues, things like that. And I'll say, look, I'm going to refer you to a psychologist for that. And great news, just the tip of the day here. Got a patient, stage 3 lipidemic, studying to be a psychologist. I have asked her already, please specialize in this. She's agreed. And I keep, every time I see her, I'm like, when is that degree finished? Because I
How
need
exciting.
you. So hopefully we'll have a homegrown psychologist that can actually deal directly with lippy ladies, because they don't understand.
No, they don't.
I don't think anyone can understand unless you've got it. That's just my professional opinion. And it's just sort of like a female obstetrician that's had kids. She knows, doesn't she?
Yeah.
You know, that's how I get.
Very cool. And do you find that the lipedema ladies that come to you, they do have those other issues, or is it not a large number of people that have multiple different issues, and it might just be just lipedema?
No, most of them have multiple issues.
Yeah, okay.
Most of them have multiple issues. I've got so many comorbidities attached to my lipedema, it's not funny. So I'm really aware of that, and that's how I treat myself, and that's how a lot of the times I'll know how to treat them as well. But I see it's, from what I see coming into the clinic, I see that it's getting worse as the disease comes through generations. I'm not seeing that phase out. Sometimes you see diseases come through, and the more it goes through the generations, it sort of washes itself out. I'm seeing this increase. That's what I'm seeing. And so I'm desperately trying to get younger patients to be aware, to get them in, because it's really easy to sort out when you're young. When you're young and you might be a stage 0. You know, super simple, not hard to do. You stick to these 3 things and you're pretty well good. But yeah, I'm seeing it's worse, and it's getting worse, and that doesn't make me happy.
No. And look, there is a certain trajectory that's been evolving over the past 5 years or so with lipedema, and the more we can facilitate that trajectory going towards awareness, which
definitely.
we're all contributing to, the easier hopefully it'll be to get those younger stage 1 people coming.
I'm starting to get the mothers come in, and then, can you have a look at my daughter? So I'm starting to get the 14, 15-year-olds coming in. Which is just brilliant, because, you know, it's not scary. I don't want to make it scary for them. I always say, look, this is super simple. We do these couple of things, happy days. So I don't want them scared out of their wits. That's not the plan either. And I've seen that through the years as well with older patients, you know, putting their fears onto their daughters, and then the daughters don't seek any treatment because they're too frightened. I've heard about enough of it. I'm sick of it. I'm not going to do anything. Yeah, definitely.
Yeah.
Oh, very good. Okay, so you see women when they're first diagnosed, like you're probably the best port of call when they're first diagnosed, like, what, Kristin, what do I do? Help me. But you also see women throughout their entire journey, and that also entails sometimes surgery and post-surgical recovery.
Most definitely.
Can you talk to us about how you support women post-surgery?
Post-surgery? Well, I hope to see them pre-surgery first, but a lot of the times I only get to see them post, when they're in trouble. So sometimes I will get the odd patient that will say, I've had and I work with many, many surgeons. I don't just work with lipedemic surgeons. I work with surgeons across the board throughout the world. So often I'll get someone contact me, I'm just flown home from America and I need, some post-op care. So the first thing that normally I would do is always an assessment. So I always, who's your surgeon? Where did you go? What did you have done? And then I always say to them, what compression are you using? Sometimes it's really interesting because it's none. So I'm always super interested about that. Then it's like, okay, have you had any complications? Like if they're flying home, one of them contacted me this morning. She's got a blood clot. I've sent her off to get a Doppler test and things like that before any proceedings. Sometimes they come in with infection, so I often send them back off to the doctor to get the correct antibiotics. I often see the wrong ones being applied there. So I say, no, wrong. You need this antibiotic. You need to go back to the doctor and get that. Sometimes I see them where they're so overloaded with compression. It's like the flip side of the coin. It's actually made them sick, and they've actually ended up septic. So it is a balance. So I always check everything, and even if they're usually pre-surgery, I'll try and set them up with their compression so I know they got the right stuff and they're fully measured and stuff like that. But sometimes I don't get to see that. So I usually check it all, ask them if they're happy with it. A lot of the times they hate it. And then I'll say, well, let's change it into something that you're more comfortable with, and that sort of thing. So that's what I usually do. I'll say, you're happy with that? Do you think that'll be better? I think it's going to be better for you, and you're going to be happier wearing it for a longer time if you're happy, because if they're not happy wearing their compression, they won't wear it, and then their recovery takes longer. So
and they won't get the results that they were hoping to get either.
No. Some of the stuff I've seen, like they get really severe keloid scarring. The fibrosis goes through the roof. And that's sort of too where I try and get, and that's why I wrote the Lipoedema surgery course, to try and get surgeons on board with what is lipedema. And this can be worldwide with any doctor, cosmetic doctor, plastic surgeon, to learn about lipedema. Because often they'll do a Brazilian butt lift. They'll put the diseased lippy fat into their buttocks, and then they've now got diseased fat sitting in those areas. So,
wowee.
yeah.
Hey, look, I'm a big botched fan, as we discussed last week, and they refuse to do Brazilian butt lifts because they're too dangerous.
Well, Paul Nassif.
Yeah.
You know Paul Nassif from Botched? He liked my lipedema surgery course. He put it on his site. Yeah.
Dr. Nassif.
Oh, so good. Oh, wow.
Okay, speaking of botched and surgery, can we I can't even talk about. Let's talk about the pros and cons of surgery. Can you take us through that, please?
I will take you through that. So let me just pop that over there. Righto. So let's go with the pros first. Let's be happy first.
Love that.
Okay, so now surgery assists with mobility. Yeah? Okay, so there was a girl a lovely girl over at the Congress. She was an American girl. She had her surgery. She was stage 4. And she was the most inspirational person I think I've ever met, apart from Lipoedema Fitness, Patricia Cornett. She's just major brilliant.
She's major brilliant.
Oh yeah, she's so inspirational. It's not funny. But this girl, she was very sporty when she was young. She got married. She had 3 boys, all very sporty. And her lipedema got worse and worse and worse, where she was sitting on the sidelines watching. She couldn't breathe properly and stuff like that. So she went and had the surgery done. From there, they didn't reduce her too much because she was still quite large at the Congress. But she actually gets a rescue dog and goes out and helps to find people who are lost on trails, like in terrain.
Oh my goodness.
So I was just blown away by that. I mean, these people were inspirational when they spoke. They were unreal. So mobility is definitely a pro of surgery. Yeah. Now surgery can be pain reducing as well. So often patients report that their pain has decreased or if not diminished. So things like and that's because they take the bulk of the fat away and it stops pressing on the nerve receptors, because all pain is nerve pain. So when you got the fat that gets taken off the nerve receptors, you have less pain. Okay. It also helps take the pressure off the veins and the lymphatics. Okay, so that's also going to help your lymphatic flow and your venous system. And we can see, Yeah, I've got that about pain, and I actually wrote an article about you can feel my pain, because a lot of people, you can't feel someone's pain, can you?
No.
You can't feel it. After surgery, you can see it. because there's swelling and there's bruising and there's all sorts of things. And you think, oh, that person's in pain. Look at the bruising, look at the swelling, yada, yada. But pre-surgery and that sort of thing, no one can actually feel your pain, and everyone has different pain thresholds. So I wrote an article on You Can Feel My Pain. When people run their fingers up someone's leg or along someone's arm, I got my husband to feel the back of my legs, because I've actually got the strings of pearls that have fibrotised at the back of my knees. And I said to him, just feel that. And he felt it. And he said, what's that? And I said, that's lipedema. That's what it is. And I said, tomorrow I'll have a bruise. So it gets people to understand what lipedema pain is. So surgery can reduce pain. Surgery reduces weight. So, yeah, good idea. So through pre-op preparations, like starting a diet, using weight loss shakes, using weight loss injections, the Ozempic, weight reducing, and the surgery itself reduces weight as well, because you've got less fat on there. So that's one of the lots of pros. Surgery also removes the excessive hangovers, so the verandas around the abdomen, which helps the flow of lymphatics and abdomen in the inguinal areas and the abdominal regions. The weight reduction reduces chafing and rashes. So some people get, sweat rashes and things like that under their breasts and things like that. So it helps to reduce that, which is great for skin integrity. So we want good skin integrity. It can help with posture. So it can reduce the weight of the breasts if people have a breast reduction. So it reduces, it helps with posture as well. It takes pressure off the joints, which decreases pain and inflammation, and can delay, and I'll say delay, knee or hip replacements, because generally I find that we generally all end up having that. Also, surgery as a pro decreases chronic diseases. So it can decrease obesity, diabetes, heart disease, stroke, kidney disease, arthritis, and cancers as well. So that's a pro. And it's aesthetic. It should be aesthetically pleasing. I'm going to say that. So we should, when you see people having plastic surgery, right, you see all the celebs and that stuff like that, it's not meant to be seen. That's what they do. So they do things and alter you, so it's a more natural way to go. So I would prefer for the surgery to be kept natural, which I saw a lot of overseas. They're very into the contouring and the shaping of the body to keep the natural curvature of the female. Any scarring should be kept as minimal as absolute possible. It shouldn't look noticeable. So aesthetics, so it's good for aesthetics. And it helps with mental health and confidence as well. So I do find I see that all the time. So physically seeing that their limbs have reduced just gives them that sense of confidence to go out into the world. And most ladies that I see, they always say to me, I just want to wear a dress to my knees or a pair of shorts, or a sleeveless top. I mean, seriously, these are small wishes at the end of the day. So I'm like, if that's what you want, let's go for it. Let's get that done. So things like that. So they're the pros that I see of surgery.
It's a nice list. Yeah.
So.
Yep.
All right. Dun dun dun.
You ready for the cons, people?
Flip the coin.
Right, hey, can I before you start? Have you had surgery, Kristin?
No.
Okay. So I just want to.
You will not.
Okay. No. I think I have not had many patients in the clinic that have had a smooth ride.
Yeah.
I've seen a couple, but they've never been lipedemic. So the ones that have had a smooth ride, which are only a few, are not lipedemic. So no, I won't. I want to keep myself as small as I can, and as healthy as I can. Yeah, without that, and I'm confident.
Beautiful.
Yeah, I'm confident. I go out with my shorts on, and if someone wants to look, go for it, because I'll just tell you what I got.
Love
It's a
it.
conversation starter anyway, and
It
that's
is.
how we advocate. Yep.
Absolutely.
Raise awareness.
Raise awareness. This is what I've got. Oh, what's that? Blah, blah, blah. So, yeah.
Yep. Okay, back to our cons. Sorry
Okay.
to take us off track.
So, well, pain is a con. So the surgery itself is very painful. A lot of patients report that they didn't realize how painful it was. So I think that's underestimated. Pain can be a long-term effect as well. So sometimes that can be a problem. Painkillers prescribed usually cause abdominal or bowel issues like constipation. So that causes pain as well. Clots are common. One had one of them today. That causes pain. Clots are painful. Pain can come in a number of different ways as well. So people may have aching, they may have stabbing pain, pins and needles, neuropathy, restless legs, nociceptic pain, which is caused by tissue damage as well. So pain can come from the surgery. Mental health. So, and I'm a big one for checking out mental health. So pain creeps into mental health because you can get down with the pain. Why isn't this pain going? I've had pain for so long. Pain can get you down. So it creeps into mental health. I find frustration and anxiety, and that's usually to blown out wait times for consults and also surgical procedures, particularly here in Australia, where they're mentally psyched up. I've got them ready to go, and then it's a couple of years down the track. So I find that really damages their mental health. There is a real risk of addiction to surgery as well. So patients suffering body dysmorphia disorder, they're more vulnerable. They may feel like they need more multiple surgeries to alter their appearance, and that can create permanent damage to muscles and skin, and also their lymphatic and their venous systems as well. So I do find that. And sometimes outcomes fail to meet expectations. So I had a patient, she saved up for 6 years. That's all we talked about was surgery. I prepared her for 6 years. She went in. She only had a small amount of very tiny complications that were quite easily sorted out. And then she said to me, "Now look at my legs. I've got granny legs. I should have never have done it." And I just thought, oh, that's really disappointing. So I felt gutted for her. Having one skinny leg and waiting for a long time to get the other one done. So people ask questions. Oh, what happened to you? What's wrong with your legs? So things like that. I call them chicken legs, where there's just been way too much taken out and it doesn't match the rest of their body.
Yeah.
So I find that definitely does mental health. Using weight loss injections to reduce weight, getting the weight down only to discover that you can't get the drug, and now that TGA has only ruled it that it's only for diabetic patients. So I find that, or using weight loss drugs or having weight loss surgery to get the weight down, preparing for surgery, and it doesn't budge the lippy fat at all. So I find sometimes that creeps into mental health, and the fact that there's post-op blues as well. People don't realise there's post-op blues that they can get, depression, and the scarring. So that's comes onto mental health.
Yeah.
Recovery time. So I don't complications of surgery. So complications are things like scarring and skin discoloration from skin excision. So I get that. So normally the skin discoloration can come from the leaking of the veins. And it's when they leak, it's the iron that comes out of the blood and it causes a brown staining. So that's what
I didn't realise that's what it was.
Okay.
That's what that is. So if you've got lymphatic leakage, it's red. If you've got vein leakage, it's brown. And if you've got a combination of both, it'll be purple.
Wow.
Oh.
So bit of thought there. Yep, got that. Yeah. It can cause lymphedema, so that's a real risk. So it can damage the lymphatic and the venous system, and that's what a lot of the different techniques are trying to solve. Scars wrongly and the venous system from the surgery, also the scars and the wrongly fitting compression garments. So I see if they've got wrongly fitting compression, that can cause that. Seromas, they can cause infections if not drained, and then if they're not drained, they then turn into fibrotic lumps. So they become a permanent fibrotic lump. Hematomas can cause clots, vein damage, infections to the lymphatic system, lymphedema, keloid scarring, and then the infections can turn septic as well. So if you're not aware of that. Also using the weight loss injection. So Ozempic comes with its own issues and body issues with you. That was on last night. I don't know if anyone saw that on Spotlight. That was interesting.
Oh,
Oh
no.
no, I missed it.
was
I wanted to
brilliant.
watch it, but I thought
Yeah, it
I'd
was
get
really good.
angry. I get really angry.
No, it was it was pretty good. They did have two sides of the story, but they missed the mental health, and that was the big thing for me, that they missed
Yeah.
that the lady had mental health issues. We can
That's what
have
makes me angry.
yeah, and me too.
That we don't address those. We just address the
Yeah.
body and we don't look after the brain.
Exactly
Yeah.
correct. Yeah, so I picked up on that. Surgery causes blood loss and iron loss, which leads to fatigue, decreased motivation, and slower recovery. Nerve damage, which can turn permanent into neuropathy as well. Complications from anesthesia can cause allergies and sickness, which need their own recovery time. Body lifts and liposuction are the highest risk and most painful surgeries someone can have. That's what it's rated
Wow.
as. So
Wow.
that was interesting. That come from Eye Clinic. And then we get to the cost. So things to factor into. This is what I've got in the guide. So things to factor into: your pre-appointments, consults to get your weight down, your skin integrity up, your fat as soft as possible, swelling as low as possible. Learn conservative management for the post-surgery recovery. Then we look at it's classed as elective surgery. So there's a lot of out-of-pocket expenses, like huge. I find that patients take out loans to get the surgery, or they take it out of their super. And in the long run, that's going to cost them even more because they're paying off interest from a loan, or they're not putting the money back into super. So that can be really dangerous and bad for mental health as well. Then they've got loans to pay off and so forth. Financial pressure on family budgets causes pressure on relationships. So it's not all monetary costs involved also. So I see a lot of that. Pre-surgery scans. Now, I had a patient who was advised to get a lymphoscintigraphy. They got it done. They were charged $2,500, and it's bulk billed. I'm like, do you know you could get that bulk billed? And she went, no. And I said, I wish you'd asked me. So
Oh, no.
that's because
That's
she went through
upsetting.
a third party. So I was not happy about that.
No.
Pre-surgeries like weight loss or vein correction. So sometimes I'll say you need weight loss surgery or vein correction surgery before the lipid. So you're on all these different surgeries even prior, and that's all very, very costly, time-consuming, costly, time off work. Compression garment costs. So pre-surgery garments, surgical garments, post-surgical garments for lymphedema and venous disease if they then come later on. So you've got garments for that as well. So ongoing cost for that. And that's where the reed sleeve kicks in, because it covers all of it, and it's one garment that can be utilised for both limbs for the next 20 years. So that's why I like them. Time off work, having the surgery, post-surgical complications, particularly if they weren't planned for, which most of them are not. They go, I had about a week off and then I've got to go back to work. And I'm like, well, you got all these complications, and then it's just trying to fit them in, and, with me or them or whatever, it's very, very difficult. So then their recovery becomes longer and longer. Fuel costs. So fuel is expensive. Fuel is up to $2.30 a litre. I'm a budgeter. And so trips to and from appointments and to and from the doctors and to and from the surgery, they could fly. They could fly out for surgery. So you've got all those travel costs and things like that, and the post-op checks, if they do them. Had a patient just go through surgery and they're not doing post-op checks, sending them to the GP. So I thought that was interesting, considering they had severe infection. So
Wow.
So post-surgery lymphatical appointments, if there's been complications, they could be worth years worth of appointments. So another cost. They may need to rectify complications. So I had a breast surgical patient in. She had breast implants. She'd had them in. They ruptured. They took them out. They put another lot in. she came to see me and she said they've gone up. They're telling me that they need to be pushed down as hard as you can push. And she came in and her husband's been pushing his heart out, God bless him. And she came in and I said, that's actually adhered to your chest wall. We're not pushing that anywhere. You have to go back and have another surgery to have it taken out. So, these things happen and people aren't aware that all these things sort of happen, whereas I see them all. And the surgery, it doesn't cure the disease. And I think this is the biggest kicker. It actually invigorates the stem cells. So I always knew that it could come back and it comes back in other areas, but I never knew why. And when I was at the Congress, they said that it invigorates the stem cells and that's what makes them reproduce at a heightened rate. So other surgeries, ongoing surgeries, are needed to keep it all nicely in shape. And the cost of the weight loss injections as well. So they're really expensive as well. Someone told me, I think yesterday or the day before, they were up about $600 a month, something like that.
For gosh,
so very expensive. So they're all the cons that I see that I've come up with. And that's why I push. So that's what made me write the Ultimate Guide to Plastic Surgery, because I thought I was having patients in, I was educating them, and I can't just do that in an hour session. There were multiple sessions where I was taking them through everything that they needed to do. And I was like, if I just wrote a course, then anyone can do it worldwide. I've constantly updated, so it's always fresh. They can jump on. It's cheaper than going for a consult. So they get on and they learn absolutely everything that they have to need to know. So then it lessens these complications. It lessens all the trouble. It lessens the costs involved. So that's why
and
I wrote
you're
the
reaching
guide.
more people. Like we need to reach more
I'm
people. And that's a
reaching more
perfect
people.
way to do it. Yeah.
Yeah. So that's why I wrote the Ultimate Guide to Plastic Surgery.
So in that Ultimate Guide to Plastic Surgery, do you mention like how to like recovery process, like how to make
everything.
sure that they're okay?
Everything. They first come up just off the cuff. So they first come up with why do you want the surgery? Why do you want it? You need to do it for you. That's who you need to do it for. No one else. You need to do it for you. So why do you want it? I address emotions and feelings. So some of the thoughts and all that we go through. So the mental health again. Then we go through how to find your doctor or surgeon. So what things to ask. So you can make that right choice, because you've got to have a relationship with this person. You've got to trust this person. So what questions to ask? Then it goes through what questions that the surgeon may want to ask. Then it goes through medical terminology. So let's get up to speed with what the surgeons are saying to you medically. So you're able to know what a seroma is, a hematoma is, and that you'll understand what all the procedures are called and that sort of thing. So then we go through, let me just think off the cuff. So yeah, all your questions, that sort of thing. Then it goes into all your compression garments. I mean, there's millions of them out there. So what do they do? What are they for? What do they do? Why do you need different ones all the time? So that goes through all your compression garment and these are for all surgeries. So the Ultimate Guide covers every single surgery, not just lipedema.
Surgery.
No, orthopedic surgery, weight loss surgery, you know it. And then so we go through all compression garments. Then we go through sort of your shopping list. So things that you can do to start to prepare. So things that you can purchase because of the different types of surgeries. So you might want a Brazilian butt, like a cushion if you're having Brazilian butt lift. You might want, depending on what staging you are, you might want to hire pumps or lift chairs or shower chairs or things like that. So it goes through all of that sort of stuff. Then it goes to how to prepare 4 months out. So you should have booked your surgery, should have booked all your your post-op appointments. You should have had your compression order, measured and ordered, or your compression garments. So they're here, you're using them, they're ready to go. Because the patient I had in today, she's been wearing her second leg that's just been done has outperformed the first leg because she's had to wear for the last, I think, 5 months, compression 24/7. So the second leg was way more prepared than the first leg.
Of course.
And she's got a much better, she's got a great result on the second leg. So I was really happy about that. So it goes into all of those sorts of things. And then it goes through what to take on the day of the surgery. So what you need to pack in your bag. And then it comes into your, who's your support person and preparing your home for when you get home. So easy things to do so you're nice and comfortable, time off work, who's looking after the kids, all these sorts of things. So it covers every aspect of your pre-surgery right through to your post-surgical recovery.
Oh, Kristin, you've thought of everything.
I try.
That is amazing. And it takes the guesswork out for your clients.
Yeah.
And anyone who, like, we'll make sure we've got all these details in our show notes. But sometimes we just need to be able to read something, just look at it and go, okay, I'm doing the right things. I'm following the steps. Like, and yeah, you've done that. So I want to move on.
Yeah.
So how do, what can women do to improve their surgical recovery? Like, how can we?
Okay. All right. So first thing I'm obviously going to recommend is the ultimate guide, because that's what it is. It's the ultimate guide. A lot of surgeons might give out 1 or 2 pages of information, but this is very, very complex. And then, so is it, what was the question? Sorry. So how do I support women post-surgery? Was that the question?
What can women do to facilitate their recovery?
Here we go.
Yeah.
Okay. Education. So educate yourself. Learn as much as you possibly can. Get multiple quotes. Like, you're not going to get your car repaired with 1 quote. So get multiple quotes, because all surgeons do different work. They do different techniques. They do different work. So you need to investigate that sort of thing. So education is absolute paramount. I also recommend, obviously, the reed sleeve. The reed sleeve goes from pre-surgery, surgery, post-surgery, all limbs, up to 20 years if you've got lymphedema out of it, neuropathy out of it, and venous disease out of it. So it'll go with you for that amount of time. I've got mine. I've got neuropathy in my legs, and I wear mine every single night, and that's why my legs have never changed. So I've never had that. I've got the new limb lotion. So the new limb lotion, which is, as I was mentioning before, got picked up by an online retailer and will be at the conference, covers everything from antibacterial to anti-inflammatory to antifungal to insect repellent to pH correcting. We've done lots of trials on this with radiation burns from radiation patients. We've done it on psoriasis, dermatitis, eczemas, wound healing, but scars. The scars, there's a picture on my website with a really bad lumpy scar, and using the lotion for 4 days, it was flattened. So I used the lotion a lot for post scars, things like that. And it's 100% natural. So there's no nasties, things like that in it. And that's what I like, because whatever you put on your skin or in your mouth will go through your lymphatic system.
Of course,
So those sorts of things. So that's what they
how
can do.
Your cream, how are they with compression? Like, we can put them on and then put our compression on. It won't harm the fibers in our
No, I made sure of that because I knew of that. So
Yes.
and it's a lotion. Now, a lotion is different to a cream. So a lotion sinks in and is non-greasy. A cream sits on the surface and is oily.
Right.
That's the difference. So it's a lotion. Yeah. All right, what else you got?
All right.
Next question.
How can we spread awareness in the medical community?
Now this is a cracker. So I like this one. So a couple of different things, and this is what I'm doing. So now I'm not sure if you're aware, but I actually attended the live surgical day pre-Congress. So I don't know if are you aware of that, the live surgical day?
I know that they had patients that you could.
So basically what happened,
get the surgery.
We got there at 8 o'clock in the morning. I went till 2 o'clock in the afternoon, and there was 5 surgeries going that day. And there was, I can't remember how many of us were in the room. I'd say, at a guess, probably around about 50 surgeons. there was the two ladies from Lipoedema Foundation. There was me. There was Linda Kahn from America, and there was Marty Klein from America as well. And the rest were surgeons. They were all, Dr. Lekic was there, Raymond was there, Beryl Tan was there as well. I went there with Tom Wright, which I had breakfast with him. I was blown away. I was like this giddy school kid. So he was amazing. He was really lovely. And he said, come with me. So I went with him and sat with him. So I went to the live surgery day. They had 5 of the surgeries going. They were all different surgeries that they were seeing who did what and what they did and stuff like that. So from there, then I developed the Lipoedema surgery course. So I used that information to write that course to teach, as I said, cosmetic doctors, plastic surgeons about what lipoedema is, so then they can uptake it. Hopefully we can get more surgeons and doctors on board who know about it, so we can open up for a bit of competition and stuff like that. Hippie Lippy Lady, so my Hippie Lippy Lady lipoedema awareness items, so they're available in store. I've got my Hippie Lippy Lady support Facebook page as well. Now, these are I've done a couple of radio interviews with 2NURFM to spread in Australia. And this is some news. So
is this an exclusive?
This is an exclusive, girl.
Ooh.
It is. In 2 weeks' time, on the 26th of April, I will be in a recording studio, and I've been commissioned to write 4 lectures, 2 on lymphedema, 2 on lipoedema for OzMed. And I don't know if you know who OzMed are, but they're the largest online medical platform in the world.
Wow. That is huge.
Well done. Yeah.
Very cool.
So it covers every single health professional, any health profession. Yeah. So I'm getting that awareness out there. So I'm doing that as well. And I'm going to do, when I've finished all that and the OzMed's gone and stuff like that, then I'm going to start a research paper as well. So after I spoke to the Lipoedema Foundation girls, who are really lovely, they guided me on how to do research. And I actually have a researcher who comes who has lipoedema. And we're going to put a research paper together. And I've got the professor in mind. My son's going to do all the graphics and like put all the database together and stuff like that. So that's what he can do. But I'm doing it on a thing called retinochesis. And I don't know if you've heard of retinochesis, but I have retinochesis. Retinochesis, I believe, and this is what I intend to prove, is actually attached to phlebolipedema. So I want to prove that it's actually a comorbidity attached to phlebolipedema, which is the lipedema that I have. So it's actually it's genetic, it's inherited, and it's lipids and proteins that form behind the eye, so behind the retina in the eye. It's made my eyesight go downhill in the last 3 years. I'm actually in the process of getting my 6th set of glasses, and I actually have patients that have retinochesis, usually in one eye, but I've actually got it in both. So that's what I want to do my paper on.
Fascinating. Kristin, we might have to get you back for an extra episode if you would love to come back to us, because I want to delve deeper in the types of lipedema that you're talking about, if that's okay.
Sure. Yeah, no problem. Yeah. Yep.
I'd love to hear more about
great.
that.
Yeah, I've only heard someone say, there's subtypes, but I don't know anything about it. Like,
well, I can teach you all of that. It's got it in, I'll put it all in the OzMed lecture, so hopefully we'll get that information out too for health professionals.
Lovely.
Ooh.
Very good. Well, we have exceeded our 30-minute episode, but I think it's been warranted because you're so full of information, and so maybe you need to be a regular guest.
Yeah.
And I can't wait to catch up with you at the Lipoedema Australia conference, because we just might have to pick your brain a little bit more.
I'm not going, I'm sorry.
Only your lotions are coming.
Yeah, only my lotions are coming. So
you're sending products but not going
I
yourself.
can't really talk to a bottle of lotion, can I?
And so when I went to Germany, it's caused a lot of damage with my lipedema, and I'm still recovering from it. So unfortunately, I just can't. At the moment, my body's in peril, and I just can't get on another plane. So
no travel.
Yeah.
That's fair enough. You got to look after you, so that you can look after us. You know.
Yeah. We might have to do a road trip to you.
Yeah.
Come to Newcastle.
Yeah.
So and that leads us to our next question. Where can the lipedema community find you?
Okay, so I've got my website, newlymphclinic.com.au, right? I've got my phone number, so they can ring me up. I always answer the phone and chat on the phone. I've got Instagram, LinkedIn, YouTube. They're all links on my website. Now I've got 5 Facebook pages. So I've got Newcastle Lymphedema Lipedema Clinic. I've got Kristin Osborn. I've got Hippie Lippy Lady. I've got Lipedema Awareness Business Support. I'll tell you about that one in a tick. And I've got Optimum Surgery. So that's for my surgical people. But Lipedema Business Support, I set that up last year because what I wanted to do is set up lipedemic business owners, so people that had lipedema business owner, with lipedemic people. So for argument's sake, if you own, like a directory, if you own a cafe and you've got lipedema, I've got lipedema, come to my cafe. Or I'm a hairdresser, come and visit me. So I set that up, as a directory. Yeah.
Very cool.
Oh, I love that.
So that sort of thing.
Hop in there.
Yeah.
Check that out.
Yeah. So that's what I sort of maintain the whole time. It takes me ages. I work every weekend on that. So a couple of things for next year, or this year, should I say?
This year, 2024.
Yeah, so I'm opening a new clinic. That's coming. But also I'm going to start using my Hippie Lippy Lady Lipedema Awareness. I'm going to start doing some posts on my sites all about education for patients. So it'll be free education for patients with all sorts of different bits and pieces. So, yeah, that's what I want to do.
That sounds so exciting. What a great goal for 2024.
And we know it's going to happen because you're in the driver's seat, Kristin, and it's just going to happen.
You and Shell are kindred spirits, can I just say? It's like I'm talking to Shell times 2.
I love it.
I love it.
Kristin, thank you so much for joining us this evening. I cannot wait to have you back.
Thank you so much. It's an absolute pleasure. Thank you so much.
Thank you.
All right. Take care.
Bye.
Take care. Bye. See you.
When we started the Lipoedema podcast, we relied on word of mouth and existing connections.
Our following has happened organically, and we are so honoured by your support.
As we learn more about the world of social media and algorithms, we have a request.
When you are listening to our podcast or watching on YouTube, let us know what you think.
Hit follow or subscribe.
Leave us a comment or write a review.
The more engagement we get, the more our message is shared.
And the greater our reach to those women suffering in silence.
Thank you for listening to the Lipoedema podcast. Lipedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipoedema podcast. Until our next episode, bye for now.